This is the Elite Highlow Flexion table. These tables are custom built to your specifications. This table is shown with 3 drops. The patient will step on the foot plate and position herself on the table. From there, we will bring the table down. This table has a peaking mechanism, which is right here, on the lumbar, and here on the thoracic. That is achieved by just simply lifting up on the cushion. To lower those areas, lifting up on this lever towards the ceiling will allow that table to come back into its neutral position. This table also has 2 drops in the main part of the table. This foot cocking mechanism is located on each side of the table. We can adjust the tension by using these knobs. Now let's look at some of the flexion components of the table. The table has a handle, which is removable. The way this works is it is simply placed right at the bottom part of the table, and it's locked in using this knob. This knob is also the knob we use to pull the handle out. From there, we can unlock the table and do our flexion. If we desire, we can also do flexion as well as lateral flexion by unlocking the table right at that knob and achieving our flexion that we need to achieve. If we are feeling that we want a little bit more force in with the flexion, we can instruct the patient to grab onto the handle, and that will stabilize the body even better. We then move from here and lock the table back in place, locking the flexion and then locking the lateral flexion. It is important that the table is in a neutral position before the table is brought up from its lowered position. We also want to, again, pull the handle out. At this time, we are safe to raise the patient by simply pushing the foot pedal. Each Elite table comes with a multi-directional headpiece, which will tilt, elevate, spread, and drop. This is the Elite Highlow Flexion table.